This study examined the use of the adult neuroscience-based SENS intervention with children with hemiplegic cerebral palsy to improve upper limb somatosensory discrimination, motor function, and goal performance. They recruited 17 children, 9 boys and 8 girls with hemiplegic cerebral palsy, aged 5 to 15 years from a pediatric tertiary hospital in Australia. Eligibility criteria: diagnosis of hemiplegic cerebral palsy, somatosensory discrimination impairment. Design and methodology. Baseline assessment took place over 2 weeks. Children were assessed at least 2 weeks after their most recent botulinum toxin therapy and were peer matched for age and manual ability classification system level. Children were assessed at baseline randomization time point 1, after 6 weeks of intervention or control time point 2, at 6 week follow-up time point 3, and at 6 month follow-up time point 4. The treatment group received the experimental SENS intervention 3 times a week for 6 weeks, 1 hour long each session by an occupational therapy trained and SENS training approach. Intervention was given in the child's home or school setting without any distractions. Goal performance was measured using goal attainment scaling and the Canadian Occupational Performance Measure. Somatosensation was measured using the SENS Assess Kids. Motor performance was measured using the Assisting Hand Assessment, and the box and block test measure gross manual dexterity and unimanual capacity.
As for the results, the primary outcome was goal performance, and the secondary outcomes that they used were somatosensation and motor performance. For goal performance, they used 2 scales or 2 measures, and they were the goal attainment scale and the Canadian Occupational Performance Measure. And for the goal attainment scale, they assessed things such as using a fork and a knife, doing up buttons and zippers, and catching a ball. And they found that there were significant between group differences at time points 2 and 3. So that was directly after the intervention and then 6 weeks after. And of course that favored the intervention group. So they also found within group differences for both groups across all time points. And they found that after intervention, the intervention group was able to attain 68% of their goals, while the control group was only able to attain only 20% of their goals. However, at time point 4, which was 6 months after the study, the control group was actually able to attain 50% of their goals. For the Canadian Occupational Performance Measure, there are similar results, with the exception that there were between group differences at only time point 2 and not time point 2 and 3. So somatosensory discrimination, they used 2 measures. One was wrist position sense, and the second was tactile object recognition. For wrist position sense, what they were testing was haptic object recognition with familiar and novel items. And over here, and for tactile object recognition, they measured wrist position sense when the child's wrist was actually moved in 20 different standardized positions. What they found was there were no significant between group differences across all time points for both tests. But for the wrist position sense test, they found that the intervention group maintained improvements up to about 6 months prior to the study. For tactile object recognition test, they were found significant within group differences for the intervention group at time point 2, and for the control group at time point 3. So that's again 6 weeks after the study. Motor performance, 2 measures were used. The first was assisting hand assessment, and then the second was box and block test. The assisting hand assessment basically allowed the children with hemiplegic cerebral palsy to use, basically they were seeing how activities that needed both hands, how the impaired hand was actually doing while using both hands to do an activity. And for the box and block test, they measured gross manual dexterity and unimanual capacity. So for the assisting hand assessment and for the box and block test, they found that there were no significant between group differences across all time points. And for the assisting hand assessment, they found that there were within group differences in the intervention group, which they maintained those improvements up to about 6 months after the study. There were no significant within group differences for the control group across all time points. And for the box and block test, they found significant within group differences for the intervention group at time points 3 and 4, and only at time point 3 for the control group. So for the discussion, this study basically was an early investigation of somatosensory discrimination for children with hemiplegic cerebral palsy. There were improvements observed in all 3 areas, and those areas were somatosensory, motor, and goal attainment. They found that goal performance can be improved using a somatosensory discrimination approach, since discrimination training can actually help and maintain limb position sense. But the reason why this study was different from all other studies, and why they probably found changes or improvements within the intervention group, was because that it was intensive, and it was they used a multimodal approach. Improvements in object recognition was found and maintained after 6 weeks with the intervention group. They also found that sense intervention is associated with improved and maintained motor function. So just to sum it up, this study basically suggests that limb position sense is modifiable and plays a very important role in upper limb use for children with hemiplegic cerebral palsy. There were between group differences that weren't observed due to the individual variations. That was the reason why they were saying that they didn't find any between group differences, and they suggest that future studies should look into and examine cortical sensory motor reorganization, severity of the impairment, motivation, and other factors when looking into treatment outcomes for upper limb interventions for children with hemiplegic cerebral palsy, so that they have a better, more holistic understanding to this area.
Implications for occupational therapy was that the sensory discrimination intervention improves children's body position, awareness, and motor outcomes, as well as goal attainment. And improvements were maintained at long-term follow-up. So this is seen as an effective treatment plan and can be used for many individuals with hemiplegic cerebral palsy. Though more research has to be done, it is a valid use. And body position sense is modifiable and may link to improvements in motor outcomes. Thank you.